Hi, Les from Retired and Living the Dream. And as the thumbnail suggests, what does a Thai public hospital like? Well, I'm going to give you some details here of a couple of friends of mine who sadly they've taken ill over the past month, 6 weeks or so. And one of them had private insurance and stayed in a private hospital. And sadly, the other one who didn't have any medical insurance ended up in a public hospital. And is a public hospital all that bad? We all know if you've got private medical insurance, so many people have said it's just like a hotel room. It's a massive difference to staying in a public hospital. And a friend of mine ended up staying almost a month in a private hospital. The facilities, the staff, everything was top notch. But then that is what the insurance pays for. On the other hand, my friend stayed in a public hospital. Now I champion the public hospitals because when all said and done, a hospital is a hospital. And I'm going to go into the reasons why I think that way anyway. I've got private medical insurance. I haven't got a lot of insurance. I've got 700,000 bahts worth of insurance and I pay 25,000 baht a year for that. I'm going to up it when I get to 66 because I'll have a little bit more disposable income. But I'm going to talk about my friend who's had 10 days treatment up to now in a public hospital. I'm going to tell you the good bits and the bad bits, so then you can make your own mind whether you go public hospital or go private hospital if you've got any insurance. When all's said and done, if you don't have any private medical insurance, it's the public hospital the way to go. And now I can give my view on the public hospital. I'm going to compare it to the public hospital in the UK because that's where I'm from, the UK. And is it as good as the public hospital in the UK? No, a long way from the public hospital in the UK. But there are some good points about the public hospital here in Thailand as opposed to the hospital in the UK. And I'm going to go through some of them. So you might have seen the video where we were on holiday as a group of people and my friend had a hand infection. We believe it was a sting or a bite or a mosquito bite, but when all said and done, his hand expanded to twice the size it was. We went to the local clinic. They just give him some medication, antihistamines and some cream to try and take the swelling down. Well, that was never really going to work. And we visited the hospital the following day after returning from our holiday, and they admitted him straight away because the infection was quite bad and it had spread around his body. So therefore, he wasn't in a great position. As the infection had spread around the body, he was in a lot worse condition. So straight away, I'd say, if you've got any doubt, any infection, don't hesitate to go and see the doctor or the clinic, because at the end of the day, by delaying it like what we did, may have made things worse. So therefore, go and get it treated as soon as you can. So he's been in hospital for 10 days as of today of making this video. And he's had several operations on his hand. I've got to say, his hand is in a dreadful situation. He's had skin taken off his hand down to the bone. He's had several cuts in his arms because his arm expanded. He had his foot had expanded and his ankle had expanded. So they were very mindful that the infection had spread around his body, and they were quite concerned with him at one time. But here we are now in day 10. The infection has calmed down because of medication that he's been having. He's still got the cuts in his arm, which they're going to determine today whether they can stitch them up, because they're just open, they are open wounds to let any pus or any infection leak out, if you like. But his hand is in a very, very bad way, and they were even thinking at one time whether they were going to amputate the hand if the infection spread any more in his hand. This is how bad it is. So, the treatment in the public hospital. He's in a ward with about 40 other people. The nurses really work hard, as you can imagine. There's 40 people in this ward. There is private rooms, but when all said and done, cost comes into it. And when he was first admitted, my friends, with all good intentions, were trying to get him to go towards a private hospital. Not the most expensive private hospital, but sort of the next step up from the public hospital. So they were making phone calls, and apparently doctors were talking to doctors, And first of all, they came up with a cost of 200,000 baht, which they wanted up front before they'd take him into the hospital. He's got some funds to be able to pay such amounts, but when I got to the hospital, I questioned 200,000 baht. That price went up to 585,000 based on 10 days after the doctors had been talking to each other. 585,000 for 10 days was at the very, very top end of his budget. And we sat and discussed, well, what if it goes on for more than 10 days? So what if it goes on for a month? It's going to be approaching at least 1 million baht then. Now, in the figures that they quoted, they were quoting 120,000 baht per operation, and they'd already done one operation on his arm, and that cost 26,000. So 26,000 for one operation compared to 120,000 baht operation. There's a big, big difference there. And it was scheduled to have the operation on this first night that he was in the public hospital. So by the time we sort of made some decisions, it was coming on to 6 o'clock. And the hospital then, at the new hospital, said they wouldn't be able to do the operation because it was too late for the doctor to assess him. So then we decided that it was the public hospital, that was the way to go. And the reason for this, because we looked upon it as, if he's going to stay in hospital for a month, even though it's in a public hospital, he was going to get a lot more treatment for 500,000 in a public hospital than he would do in the private hospital. So that was the way we went. And are we disappointed with his treatment? In some ways, yes. In some other ways, it's a public hospital. You've got to wait your turn. This is the thing that you've got to understand. If you're in a private hospital, there are a lot fewer patients in there. So therefore, if they make a plan, the likelihood that they will carry on with that plan. I'll give you for an example, the last operation he was due to have, he's still got some dead skin on his hand. So therefore, they were going to remove the dead skin on his hand. And they prepped him 5 o'clock in the morning, give him his last food and drink. And usually 6 hours afterwards, they were going to do the operation. The doctor had already been told him that, you know, we are going to do the operation today. And he got to 11 o'clock on the night. So he had no food or very, very little drink during the day. And at 11 o'clock on the night, they said they've had too many emergencies in, so therefore they had to cancel his operation. This was on the Friday, so the likelihood of his operation was going to be on the Monday or the Tuesday the following week. So therefore, over the weekend, nothing is going to happen unless anything serious happens, there is. But we visited him almost on a daily basis for the 10 days, and the hospital is full. The ward holds 40 odd people, then it's got overspill, which is in the corridor. And I've got to say that the turnover of patients in the beds is very, very high. So the good bits and the bad bits about my thoughts of this. The good bits for me is experience by the doctors and the nurses. Because you're dealing with so many people, the experience is going to be gained by the knowledge that you learn in a public hospital. And when all said and done, a doctor, even in a private hospital, at some point in his career, he'll have worked in the public hospital, and that's where they get the experience, because there's a wide number of injuries and accidents and things that they have to deal with in the public hospital compared to the private hospital. So I think the doctors are experienced in the public hospital. The bad part about it is that you have to wait your turn. Unless you're so ill, you jump the queue, like my friend Mick, he's had to wait. There were other more important cases that needed the doctor's attention than taking the dead skin off his hand. That's one of the sad realities of a public hospital. But then it's far, far cheaper to stay in a public hospital than it is in a private hospital. So when all is said and done, my wife asked me whether, because I've always said to her that if I'm ill and I'm not responsive to everything, take me to the public hospital, because the public hospital, my funds will go even further. At the minute, I'm insured for 700,000, but when I'm 66 and my premium goes up, I'm going to increase that to at least 1.5 million baht. At the moment, I feel healthy, so I'm quite happy with the 700,000 bahts worth of cover. Now my friend for the 10 days is at the minute just slightly less than 100,000 baht. That's for 10 days. Bearing in mind in the private hospital, that 10 days would have been 585,000 at a rough cost. Who knows, it might have been less because he hasn't had as many operations. He hasn't had to stay in the ICU. The ICU was quite expensive in the private hospital, but 500,000 baht in the public hospital goes a long way in comparison to the private hospital. He's sharing the ward with 40 other people. Is that a big hardship? Because when all said and done, if you stayed in the public hospital in the UK, you'd be in a ward also. So for me, that doesn't make any difference. So I hope you found this video informative. Best wishes to my friend, and I'll keep everybody updated that are asking. There are many people asking about his conditions, and I will let you know how he's doing. But insurance, I would say, is very important. Even if you've got a small insurance, it's better than nothing at all. 100,000 baht for just over a week's treatment. It's not a small amount of money, but if you haven't got that amount of money, then you're stuck. If you haven't got any insurance and you can't afford insurance and you have your 800,000, then you can use that as a get out of jail card and use that 800,000 baht towards your hospital fees. When all said and done, you can use an agent to sort your money out. The biggest problem is health is wealth. And if you haven't got your health, then you haven't got a future. So take care of your health. Be proactive as opposed to reactive. Like in my other videos, go for your test, go for your blood test, find out if there's anything wrong with you before it happens, and then you can treat it before it happens. So I hope this video was helpful. Thanks very much for watching. Until the next time, bye for now.